Dr. S.P.MANJUNATH, Senior Veterinary Officer, Veterinary Hospital, Karnataka, finished his B.V.S.c during 2005 to 10 from Veterinary College, Bangalore. He finished his Masters in Veterinary Surgery and Radiology from Veterinary College, Bidar during 2010 to 13. He joined Department of Animal Husbandry and Veterinary Services, Karnataka as Veterinary Officer in 2012 and is working at Tumkur District, Karnataka. He participated in 30 state, national and international seminars and conferences and presented 60 research papers. He also published 15 articles in national and international journals. He presented 35 research abstracts in various conferences. He got 20 awards for his outstanding performance in the field of veterinary surgery and radiology. He conducted more than 4,000 surgeries at farmers' doorstep. In 2022, he got Best Veterinarian Karnataka Award from Indian Veterinary Association for his outstanding performance in the field of veterinary surgery. We request Dr. Manjunath sir to take the dais.
Good evening, everyone. Myself, Dr. Manjunath S.P., working as Senior Veterinary Officer at Nonuninkere Veterinary Hospital, Tumkur District, Karnataka. First of all, I am very much thankful to Lava TN for giving me a second opportunity to interact with you all, and giving an opportunity to a field veterinarian to present his service related matters and his experiences in a platform like this is a very big task. And I'm very much glad to Lava TN for giving me this wonderful opportunity to interact with you all and to present my experiences. As you all, I know majority of the audience here are the field veterinarians. I am also a field veterinarian working in the field since last 10 years. So I am presenting the some case related topic, that is means bloat. I am presenting it with the cases. So in all my presentations, I always used to present with the cases. So because of that, it will be helpful for the veterinarians to treat the cases when we see the cases, and we will get confidence when we see the actual cases. So hereby I am presenting the topic bloat in large ruminants and its management. As we all know, bloat is one of the emergency conditions in veterinary large animal practice. So bloat, I am covering every aspects of the bloat here. So as we all know, bloat is an abnormal distension of rumen and reticulum that is caused by excessive retention of the gases which are produced during the fermentation, and either in the form of persistent foam mixed with the rumen contents or as free gas. So this will lead to bloat. And why the bloat occurs? Mainly in large ruminants. Whenever there is the digestion occurs, mainly in the rumen, there will be microbial digestion occurs. Whenever there is fermentation, some gases like methane, carbon dioxide will be produced. So they will be erected out of the body, mainly orally. So here I am showing this, mainly the gases produced will go out of the body orally. Only some part of the gas will go rectally. So main route of erection of the gases produced during the digestion is orally. So whenever there is some obstruction to this erection, that will lead to bloat. Either it is a frothy bloat or free gas bloat. Whenever there is problem related to erection, that will lead to two types of bloat. Frothy bloat is also called as primary bloat, and second one is the free gas bloat, that is the secondary bloat. Since some other related affections will be there, because of that, secondarily there will be accumulation of the free gases. So that is the free gas bloat. So another classification is persistent bloat and recurrent bloat. So this is another classification. And coming to frothy bloat, as we all know, frothy bloat occurs whenever the animal takes majority of the time, some animals will be referred to as in dead position. The animal will be taken to the grazing. The animal will die within 5 to 10 minutes. Some animal may die because of this frothy bloat. That is the severity of the condition, the frothy bloat. Most emergency condition treating by the veterinarians, that is the frothy bloat. So primary ruminal bloat or frothy bloat. Normally, the gases produced in the rumen, they will be small gas pockets will be there. They will all coalesce, come to the top, and they will be erected out of the body. This is normal phenomena. But whenever some green succulent fodders are taken, while the digestion happening, the froth will be producing. So that froth will hinder the erection of the gas. The gas bubbles will not coalesce to form a big gas pocket to go out of the body. All small bubbles will struck in the froth. So that will lead to failure to erection of these gas, so the rumen will be distending as much as possible. That will lead to bloat. This is the mechanism of frothy bloat. And sometimes the froth producing during this will not go out of the body. So mainly the animals taking the pastures like legumes, or sometimes very finely ground materials are given, any grains, when they are finely ground and given to the animals, they are very rich in carbohydrates. High energy rich diet is given at a short time, it will ferment, and that will also lead to frothy bloat. That will lead to production of the froth. So this is a case presented with the frothy bloat. And the animal is in distress. So the rumen is bulging, so it is exerting the pressure on the diaphragm. So because of that, the animal will show open mouth breathing, and huge enlargement of the abdomen will be there. And when we put trocar and cannula, if it is an emergency condition, we will know we should put trocar and cannula to take the animal, to survive the animal for few more minutes. Whenever we are doing some procedure, so we need some time. So if we put trocar and cannula, in case of frothy bloat, it will not help much. So this trocar and cannula size is not enough to take out the contents. So if it is a free gas bloat, if we put trocar and cannula, it will come out immediately. That will give relief to the animal. In case of frothy bloat, even after putting the trocar and cannula, it will not help much. It may be helpful for putting some medications through the intraruminally. So this is after a treatment with the anti-foaming agents. So this was a case of frothy bloat presented and treated with the anti-foaming agents. That is one case. This is another case. This is presented like this with two severe case. It was presented in lateral recumbency. The animal is unable to respirate. So that was the severity. So I immediately went with the rumenotomy and removed all the frothy contents. The animal survived. So this is the clinical judgment. This is after recovery. The clinical judgment is very much important when we are treating the cases. That is about the frothy bloat. So coming to frothy bloat, what all should be done? Whenever a case is presented, so when we diagnose it as frothy bloat, how to diagnose it as a frothy bloat? So if possible, we should put one stomach tube. If it is a free gas bloat, the all gas will come out within fraction of seconds. If it is not relieving, after also putting the stomach tube. And whenever we take out the stomach tube, some frothy material can be seen at the tip of the stomach tube. And when we can identify it as a frothy bloat. So then we can treat the case. Whenever we get a phone call from the owner, first what I advise is to give any vegetable oils, 250 ml, mixed with 1 liter of warm water. It should be drenched to the animal. So what this will do is, it will remove the froth. Immediately at the farmer doorstep, what he can do is this one. We can mix the vegetable oil, 250 ml, any vegetable oils, with the warm water. Why we are adding warm water here is, in order to disperse it. Whenever we give any vegetable oil to the animal, it will not disperse all into the rumen. So it will just settle down in the rumen because of the density. Whenever we mix it with the warm water, it will spread. So that will lead to remove of the gas. That is the one thing. Second thing is giving the anti-foaming agents. So many products are available in the market like Tyrell, Blotosil. It can be given 250 ml per 500 kg body weight. It should be given immediately. All the froth will dissolve. The gas will come out. Another thing is, we should add an antibiotic with this. In order to decrease the activity of the bacteria, we should give one antibiotic. This is about the frothy bloat. Usually the frothy bloat will subside within 2 to 3 hours. Otherwise it may take 1 day also. If even after 1 day the bloat is not subsiding, so we should think about something else is causing this. This is how we can go with the frothy bloat. Coming to the free gas bloat or secondary bloat. Free gas bloat, here immediately this is a case presented to me with the bloat. I passed stomach tube. And immediately after passing the stomach tube, the gas relieved completely. This is immediately after passing the gas. So this indicates that only free gas is accumulated. So immediately after the removal of the stomach tube, it removed. The bloat dissolved. But after some time, once again there was bloat. This is common in case of free gas bloat, since some other affection leading to the bloat. So when we are removing the gas, at that time the gas will go out. But after some time, it will recur. So we should treat the primary cause. We should identify the primary cause. So how to identify the primary cause? So there are so many causes for this free gas bloat. I am going through them one by one. And for the organizers, one thing is the time allotted for this session is 1 hour, and tomorrow about cesarean section 1 hour is allotted for me. So now I will take 1 hour. After that you can interrupt me. I will stop today, and I will continue the same topic tomorrow, and I will cover both cesarean section and remaining topic tomorrow, so that I can cover both the topics satisfactorily. That's why, and I cannot burden the organizers also. I know their problems too. So coming to the esophageal affections, there are so many esophageal affections, ruminal affections, and other affections which will lead to free gas bloat and even frothy bloat too. First one, the foremost thing is esophageal obstruction. Whenever there is complete obstruction of the esophagus, there will be free gas bloat. It is a most emergency condition. So why esophageal obstruction is an emergency condition? The complete esophageal obstruction will lead to severe bloat, which will exert the pressure on the diaphragm, that will lead to death. So another thing is esophageal obstruction will lead to aspiration. Aspiratory pneumonia, a dangerous condition to treat. Third one is it will lead to metabolic acidosis. So these are the three important things why it is an important condition. Peculiarity of esophagus is it lacks serosa. There will be tunica adventitia, muscularis, submucosa, and serosa. And the diagnosis of esophageal obstruction mainly based on history, clinical examination. And coming to the history, main clinical sign is there will be drooling of saliva. And in case of cervical esophageal obstruction, we can palpate the foreign body. Whenever the complete obstruction is there, severe bloat will be there. So this is the primary sign, salivation with the bloat. And in case of cervical esophageal obstruction, we can palpate it at the cervical region. So this is a case which was presented with bloat and severe salivation. So while palpating the esophagus on the left side, we can see that some obstructed material in the left side. Some freshers may confuse larynx as a foreign body, but after some experience we may rule out it as a normal thing. So at this region, larynx sometimes may feel like a foreign body. That is normal thing. After that, if we get any swellings, definitely that is a foreign body. So signs of aspiratory pneumonia. How to identify aspiratory pneumonia? The animal will be continuously, the nostrils will be relaxing and constricting, and relaxation of the nostrils indicates that there is aspiratory pneumonia, and it can be very clearly diagnosed by auscultation of the lungs region. So clinical examination, very important clinical examination to identify cervical esophageal obstruction without radiography and without ultrasonography is offering the animal with the water. So whenever the animal takes water, within 5 to 10 seconds, it comes out through the mouth or through the nostrils. Definitely it indicates some problem related to esophagus. So here the animal was presented with some salivation. After offering the water, animal vomits the water immediately within 5 to 10 seconds. This is a buffalo presented with bloat and severe salivation. So immediately after offering the water, the animal vomits it. So as we all know, vomition is not at all a sign in case of ruminants, but only during esophageal obstruction the animal will vomit whatever it takes within 5 to 10 seconds. So palpation of cervical region will show the obstructed material in the left side of the esophagus. Then passing of the stomach tube. So this will give clear idea whether there is esophageal obstruction or not. So passing the stomach tube, where the foreign body is located, we can locate it. But never we should use the stomach tube to push the foreign body to the rumen. Only in the last resort, whenever the foreign body is obstructed in the thoracic region, whenever we have no option, we can push it into the rumen. Otherwise, always try to take out the foreign body orally. If it is not movable, then go with the esophagotomy. So never push it. Whenever we get the obstruction in the thoracic region, even after ruminotomy, we are not able to pick it out through the thoracic esophagus, then only we should try the pushing. Otherwise, what happens? This is a case presented to me from a long distance. There was severe swollen area at the brisket region. This was a clear case. There was clear history of the animal taking some round foreign body. So after that, so many are tried and they were unable to remove it. Then referred to me. When I visited the spot, there was severe brisket edema. So I was unable to locate the foreign body. I first inserted stomach tube, but it was going somewhere. I came to know that. So there was esophageal tear. So I referred the case to veterinary college. They did endoscopy, and the whole esophagus was necrosed. It was blackish in color, no, and turned. They took out the foreign body after confirming from the endoscopy. So this will happen. This was a round foreign body. Definitely it is a movable one. Definitely we can remove it through the orally. That we can attempt for that. And so many are tried and pushed. Already sir in the previous session explained this. So the wrong handling of the stomach tube led to 3 spots tearing at the of the esophagus. Coming to differential diagnosis of the esophageal obstruction, one in case of cough, if the milk is coming out, we should check for the cleft palate. And second thing is, in case of if it is a cough, regurgitation, the ruminal content is coming out through the mouth. Ruminal drinkers, I will explain in the future slides. The cough of age of 2 to 6 months of age, regurgitating the ruminal contents. This is the ruminal drinker condition and not related to esophagus. Since we can see ruminal content there, I will explain in the future slides. Third one is the rabies. Along with the salivation, the animal will develop the nervous signs, and because of that we can rule out the rabies. But we should always be careful while handling the esophagus. Any time when we get the case of severe bloat, even though we know that there is some foreign body, we should first apply trocar and cannula. Since while handling the animal will collapse. So first we should apply trocar and cannula. How to apply trocar and cannula? All are knowing that. I am just showing for the freshers. First just give 1 or 2 ml of local anesthetic at the left flank after shaving. So after that give a nick incision onto the skin and to the muscles. Then place the trocar and cannula. With single movement you push it into the rumen. So at single movement it will enter. So you should remove the trocar, and some trocar and cannulas have the 2 holes at the sides. We can fix it to the skin. So whenever we are handling the cases of bloat with cervical esophageal obstruction, first apply the trocar and cannula. So this is how we should apply trocar and cannula. In many conditions it will be definitely helpful, and in that case there was some obstruction. I used wooden mouth gag prepared at the spot of farmer's doorstep. Since it was an emergency, night emergency, we will not be knowing what is the condition, so we are not taking everything there. Whenever we go to the spot, we will diagnose it as esophageal obstruction. So based on available resources, we prepared one mouth gag and we removed it. But as sir explained in the morning, we should be very careful while using the gags. And coming to the management of esophageal obstruction, one thing is per-oral removal of the foreign body. Second thing is the esophagotomy. If it is at the thoracic region, then ruminotomy. These are the 3 steps we can follow. This was a case of complete esophageal obstruction with bloat and hypersalivation. The animal there was severe salivation and there was bloat. So initially I applied trocar. Trocar and cannula was applied, the gas was relieved. So now I have so much of time to handle the case. This is the primary step. After that, we prepared one wooden mouth gag on the spot, and I inserted it into the hand, and the foreign body was removed. How to remove the foreign body with this method? So one person should push the foreign body. First we should check whether it is movable or not. If it is movable only, we should attempt it. So one person should push it and we should hold. He is the very important person. Even though we are capable of removing the foreign body, if that person who is pushing is not doing his job perfectly, then we will end up with a failure. So one person should press it and hold to the cervical region, and another person should insert his hand through the mouth and remove the foreign body. And always a vet should do this. So sometimes if any other person is doing, there is every possibility of damaging the cartilages by thinking it as a foreign body. So here we removed one foreign body, and first we should apply the trocar and cannula. After that only we should do these procedures. So for this we should know the type of the foreign body, whether it is movable or not. Available mouth gags are ready-made. Available mouth gags are there. Otherwise, wooden mouth gag which can be prepared on the spot can be used, and we can go to any local carpenters. He will do within 5 minutes, and we can use it. Otherwise, a iron pipe can be used. 3-inch diameter will be helpful. So because of this also we can remove the foreign bodies. And another mouth gag is PVC mouth gag, and this is also can be used in case of emergencies. So this is another mouth gag with this available in the dispensaries. If you are comfortable with this, we can go with it. Coming to esophagotomy, sedation, if it is needed, we can go with this. So this is a standard thing, BXK combination, that is buterphenol, xylazine, ketamine for the standing anesthesia. That is 0.01, 0.02, 0.04 milligram per kg body weight should be taken in a single syringe, and it can be given intramuscularly or subcutaneously. Otherwise, we can go with the xylazine alone at the dose rate of 0.03 to 0.05 milligram per kg body weight. So if it is needed, if animal is very ferocious, we can go with the sedation, and then with the local infusion. This is removal of the foreign body. This is how we removed so many foreign corn cob in this particular case, and beetroot in another case, and so many cases are there. I will just go through one by one. Trichobazar was removed in one case. First a bigger hole was, smaller one was made. We were unable to remove through this. Once again we made one bigger hole and removed it. So this is the animal. Since so many cases will be presented in the evening, they will offer concentrates in the evening. Along with that, they will give some vegetables like this without chopping. So this watermelon rind, because of the watermelon rind, there was esophageal obstruction. So we removed it through the wooden mouth gag in the evening hours. So the esophageal obstruction is one of the emergency condition which will disturb the veterinarians 24/7. So this is another condition with the esophageal obstruction at the cervical region. The animal is showing all the signs, that is salivation. Severe salivation is there. All the area is with saliva only when I went to this case. So complete saliva. So this will lead to metabolic acidosis. So we should, after treating this case, we should treat for acidosis too by sodium bicarb. That is one thing. This cervical region, some foreign body was palpable. So with the help of wooden mouth gag, this foreign body was removed, and this was the coconut pieces. So that was removed in this particular case, and animal recovered. This was a case presented to me 2 days after the obstruction, and it was not diagnosed actually. So it was relieved in 10 minutes. So things to be noted is, person A is very important, who is pushing the foreign body towards the mouth. Another person we should be aware of the cartilages, and we should remove it. Whenever only it is movable and smooth, it can be attempted, but more than 1 minute we should not be inserting our hand and attempting. It will lead to choke. Animal can't be able to respirate. So another thing is removal of fishing hook from the esophagus. This will not lead to bloat, but definitely the animal will be in distress. Animal will not take anything. So it was very easy. It is very easy to remove the fishing hooks whenever they are obstructed with the long thread hanging out. This will be easy to remove. This was a case obstructed in the tongue. We removed it with the artery forceps. This is another case which was presented in the night time with a long nylon rope hanging out, and the owner, knowing that it was fixed with the fishing hook. So it is very easy to remove this, but it was stuck somewhere in the esophagus. So without surgery, we removed it. I took one iron wire. One iron wire was taken, and a circle shape was formed in the cranial aspect. So for like this. So one from this circle shape, that thread which is hanging out was taken out. With another hand, I am pushing the fishing hook, that wire. It was stuck somewhere in the esophagus. So with one moment, it will dislodge, and it was taken out. So even by doing surgery also, removal of fishing hook is very tough. Locating the fishing hook point is very tough, but by this method we can remove it very easily. So this is how we did the one. We took one iron wire and made one circle shape in the cranial aspect. So from this shape, that wire should be passed, and just pushing the wire into the oral cavity and pushing it. Even then, while taking it out, it may tear some portion of esophagus, but we are helpless. Since even by doing esophagotomy also, searching the only fish hook is there, it will be tough. But this method is very helpful to remove the fishing hook. Within 5 minutes, we removed it, and the animal was saved. So another minimally invasive techniques are there still under the researchers. In veterinary college, Bangalore, they did some research of this. I personally never attempted this, but they did. I will just explain it. So here, a percutaneous approach and another approach by dissection of muscles. Two approaches are there following. Percutaneous approach is here after aseptically clearing the portion, they are inserting one needle with a nylon rope. A needle is attached to a nylon rope. Percutaneously, after holding the foreign body, they are piercing the needle into the esophagus. So from that they are removing the needle perorally by locating it. Easy. Even they are doing after opening also. Still research are going on about this. Passing a needle, it will struck into the foreign body. Through that, they will pass another wire and they will take out like this. So still research is going on. Another thing is, after dissection, after opening the muscles, after getting the esophagus, they are doing same procedure. So coming to the esophagotomy, anesthesia is given. Suture material should be polyglactin 910, number 20. And this is an important step during the esophagotomy is, this is the esophagus. We should always apply tourniquets at the cranial aspect and caudal aspect. This is a tourniquet we should apply to the cranial aspect of the esophagus. This is the caudal aspect of the esophagus. So this will prevent the contamination of surgical area by saliva, and this will prevent contamination of surgical area with the ruminal contents. So we should always apply 2 tourniquets during the surgery. This is one important step during the esophagotomy. Second thing is giving the incision. Always we should not give incision on the lateral aspect of the esophagus. We should always give the incision on the dorsal aspect of the esophagus. This is the second thing which will definitely helpful post-operatively. And third thing is, we should not always give the transverse incision on the esophagus. Vertical incision should not be given, always longitudinal incision should be given. Since the blood supply to the esophagus is segmental, if we give vertical incision, all that part will be devoid of blood circulation. So always give longitudinal incision on the esophagus. That is the third thing. Another thing is, post-operative management is after surgery, which should be withheld water and feed for the 24 to 36 hours. After that, water can be given and slowly fluid, the gravel type of fluids can be given, and then we can give normal feed. This is the most important thing is the esophageal obstruction with the rexin material. So the foreign body will not move at all. It will be struck, it will be just like stone. Whenever the vegetables are given, beetroot, while swallowing only esophageal obstruction occurs. But this, after swallowing the rexin material in the rumen, they will be digested and they will form into a hard mass. So while the animal is ruminating, it will come back and struck in the esophagus. So even after doing esophageal surgery also, removing this will be tough. It will be struck like this. So this is the one thing, this is recovered animal. So this is about esophagotomy. I will just go through another case. This was an animal which was presented with bloat and handled for 3 to 4 hours by others. So this was presented, and the condition of the animal was very, very worst. And by oral handling, there was too much of blood. And we went with the esophagotomy, removed the beetroot, and this animal, with this showing that aspiratory pneumonia has developed. Animal was in a very worse condition, and there was constriction of the nostrils, and animal was severely affected with the esophageal obstruction and also by handling. First I did trocherization, after that I went with the surgery. Another thing is, this type of animals after surgery needs fluid therapy for more days. So in this situation, we can go with the cannula. This cannula was applied, it was in place for 5 days. So that fluid therapy can be done, it will be easy to follow up the case with the cannula. In dogs, we are regularly using, same thing can be used in the large ruminants also. This is after recovery, after 20 days, the animal recovered both from the esophageal obstruction and also from the aspiratory pneumonia. So this is the important thing about this. And coming to thoracic esophageal obstruction, whenever the foreign body is struck in the thoracic esophagus, only we can attempt for the doing ruminotomy. It was a case presented to me after 3 days of obstruction. There was severe bloat, it was handled very badly, and there was severe salivation, and we offered water to the animal, and the water which took by the animal came out within a fraction of 2 to 3 seconds. I just fast forwarded the video because of the time constraint. So I placed stomach tube just to know the location of the foreign body. So after passing the stomach tube, I am locating the foreign body. It was struck at the esophageal inlet, that is esophagus entering into the rumen, that is the thoracic inlet. Up to that area, we will assess the foreign body location. this is the area, that is the thoracic esophagus area, so where the foreign body is obstructed. So we did do a ruminotomy, myself with my wife did this surgery. She is also a vet, and this is the nylon material along with one needle. It was stuck at the esophageal inlet. So we removed it by the ruminotomy, and I just confirmed it as whether the esophageal obstruction is cleared by passing the stomach tube, and surgery was completed. Even then this animal could not be saved because of the severe aspirator pneumonia which happened. So this is the severity of the aspirator pneumonia, and the animal succumbed after next day after the surgery. So always we should handle carefully, and fluid of choice during esophageal obstruction is either NS or Ringer's lactate. If we are giving NS, we should add soda bicarb. So there will be metabolic acidosis. So for that we should always use soda bicarb 2 to 3 days after the surgery. And management of wound caused by trocar and cannula. This is always a confucius thing for the veterinarians, including me when I was initially joined to the service. So whenever we are putting trocar and cannula, after removing it, whether we should suture it or not, my suggestion is not to suture at all. Even though there is a big wound, we can leave it as it is. Yes, sir. Yes, sir. Yes, sir. Yes, sir. Yes, sir. But in that condition, we are first we are treating on the day of surgery. We are giving Lasix, sir. For treating, we are starting the treatment with for the already happened aspirator pneumonia. On the day of surgery itself, we are giving the Lasix along with anti-inflammatories and antibiotics. On the day 2 and day 3, based on depending upon the condition, we can give the fluids. But we should give the fluids to survive the animal, sir. Sir, that is the challenging thing, sir. So that is the challenging thing. But usually in my service, the animals recovered, sir. So, but if there is severe aspirator pneumonia, it is tough to survive the animal even after vigorous treatment. Sir, I am after surgeries, I am using the streptopenicillin, BID. Yes, sir. In all surgeries, I am going with only streptopenicillin, sir. Whenever, yes, morning 2.5 gram, evening 2.5 gram. Whenever I suspect the infections like peritonitis, I am adding one more antibiotic like enrofloxacin, sir, for both gram positive and gram negative bacteria. So, sir, 2 liters, minimum 2 liters per animal. Sir, another thing, this is the trocar and cannula. When we apply trocar and cannula, the rumen will come and adhere to the muscles. So, when we remove the trocar and cannula, there will be adhesions. The ruminal contents will not enter the peritoneum. So, we should leave it like this. We should just treat the wound. If we are opening it and once again resuturing it, we should remove all the adhesions. We should suture the rumen. For that, we should give big incision. And during that process, that may contaminate, that may lead to peritonitis. So my suggestion is to treat it as open wound. This is the case of trocar and cannula applied, and this is after recovery. So this is the one thing. So these small trocar and cannulas can also be used. 12 gauge, 14 gauge needles are also available. So these can be used. Sometimes what happens is extraluminal obstructions. So this is a case was presented with a bloat, and while palpation I could palpate some mass in the esophagus. So it was diagnosed as esophageal obstruction and it was operated. And while opening the surgical site, I noticed it as an abscess. So this is a very challenging case. And the abscess, which was extraluminal on the esophagus, and it was exerting pressure into the intraluminally. So while surgery, I just gave incision, whole pus material came out. So I placed on seton and I closed the site, and the animal was recovering, but the owner was not willing to keep the animal for more days. He sold the animal after 3 days. I could not able to do the follow-up of this particular case, but this is just showing that the extraluminal obstructions can lead to bloat. So this is the surgical site, and this is the site from where that abscess was cleared, and I sutured and I just put on seton. Another thing is esophageal groove dysfunction in cows. This is the most important thing causing bloat in case of cows. So what happens is whenever a calf borns, there will be more than 60% of the stomach will be occupied by the abomasum. That means abomasum is very much developed in case of cows than the rumen. When it grows, then the rumen will develop. So initially only abomasum is the developed one. Whenever we are giving milk, whenever we give milk to cow, definitely it will go to rumen, it will ferment, it will lead to acidosis. So we are not giving milk to the cows. We are giving milk to the cows. Why? There will be esophageal groove. Whenever the cow takes the milk, it will enter directly into the abomasum, bypassing the rumen and reticulum and abomasum. Directly it is entering the abomasum, so it is undergoing digestion. So that is the thing. But when in cows, when we allow the animals to eat both the grasses and also allow the animals to take milk, what happens is, whenever from the buckets we are feeding the milk, the esophageal groove will not be forming. It will directly enter the rumen. It will undergo fermentation. That will lead to bloat. So esophageal obstruction dysfunction will lead to bloat. This is a major thing causing bloat in case of cows. So I will just show some cases how they will be presented. So this is a case of calf of around 2 to 3 months old. So there was severe bloat. So animal will be presented like this. So after presenting this, first we should remove the gas and we should treat it for the acidosis. There will be definitely acidosis. The rumen, whatever the milk animal takes will enter the rumen. So this is after removing the gas, and we should treat for the acidosis by administration of soda bicarb. So this is the case of ruminal esophageal, the ruminal drinker. That is what I told. That is esophageal groove dysfunction. This is another type of presentation. So animals will be presented with a different signs. This is a calf after taking the milk. After 5 minutes, it is coming out. So this is also one case. Even in case of megaesophagus also this occurs. Even in case of ruminal drinkers, that is esophageal groove dysfunction also this occurs. So this is another presentation. Animals taking the milk and feed and water normally, sometimes they will regurgitate all the ruminal contents. So this is another form of presentation of esophageal groove dysfunction. So this is the animal after treatment. So how we can treat the esophageal groove dysfunction in cows? So just a half pinch of copper sulfate, which should be kept on the mouth, on the tongue, and should be allowed for the suckling. So whenever we are putting copper sulfate onto the mouth, immediately there will be formation of esophageal groove. So whenever we are allowing the animal to drink milk, just put copper sulfate, immediately you leave it. So animal will drink the milk. It will be, the esophageal groove will be there for 1 or 2 minutes only. So during that time animal will take the milk, so it will directly enter the abomasum. Normally when we are allowing the animal to take green fodder, we can just leave it. It will enter the rumen. Whenever we are allowing the animal to suckle, just give half pinch of copper sulfate orally and allow. This should be done for 7 to 10 days. Sir, yes sir, on the tongue. Yes sir. Just immediately after putting the copper sulfate, esophageal groove will form. Just allowing the animal immediately after putting the copper sulfate. Even for the same purpose, sodium bicarbonate also can be used. After in normal times, we can allow the animal to graze normally. So this is about the esophageal groove dysfunction. And sodium bicarbonate also can be given. Abomasal bloat in cows. This is another condition in cows which will lead to bloat. So how to differentiate it from the esophageal groove dysfunction? Abomasal bloat occurs in very young age. Whenever the animal is taking only milk, they are not at all allowed to take green fodder. Whenever the animal is lead to take green fodder, esophageal groove dysfunction will occur. Whenever the animal is not yet allowed to take green fodder, only it is on the milk, it may lead to excess amount of milk which is taken by the animal, or milk replacers which is taken by the animal, ferment, and it may lead to abomasal bloat in cows. The only differentiation is the age of the animal, what the feed animal is taking. So this will lead to abomasal bloat. This is the same like esophageal groove dysfunction. This occurs a few weeks after the birth. Major 5 to 10 days. There will be unilateral or bilateral distension of the abdomen. So we should take the animal to the dorsal recumbency with a large size bore needle. We should remove the gas and we should treat it for the acidosis. How to treat for the acidosis, I will come in the future slides. And another differential for the water, that is in bloat in case of cows, that is water intoxication. So every veterinarians are noticing this condition. So I am just explaining why it occurs and how we can treat it. Water intoxication in cows will lead to severe bloat in some cases. Mainly there will be reddish urine. So many farmers will call and tell that my calf is voiding red color urine from so many days. So this is how the animals will be presented. Whenever the animal takes huge quantity of water, there will be severe bulging of the stomach tube. This is after recovery. This is after treatment, the animal recovered very well. So this is the water intoxication. Why this happens? This happens since in our practice, we are not allowing the calf to take water. Actually, normally the animal should be allowed, the cow should be allowed to take the water from the 2 weeks of age. But many farmers are just feeding their cows with the milk only by many misconceptions. We should allow the calf to take the water from the 2 weeks of its age only, one thing. Another thing is, many farmers what they will do is, they will give ad libitum of water in the morning. They will take the animal for grazing. And they will come back in the evening, from the morning to evening, they will not give water. In the evening, they will allow it to take ad libitum of water. So animal will be very thirsty when it returns to the home. It will take the water not as per the requirement of the animal. It will take as per its capacity. So it will take huge quantity of water. That will lead to hemodilution. Because of this, what happens is, so I will just explain the pathogenesis in next slide. The failure to provide water and salts. Salts will not be given to the cows. That is one thing which will happen. Access to the water after long duration of restriction, that will lead to bloody urine. And without access to additional water supply, and they will give raise the animals, that will lead to severe bloat, hemoglobinuria. Sometimes there will be nervous signs too, like hyperesthesia, muscular tremors, nystagmus, depression, hypothermia, salivation, colic, diarrhea, arrhythmia, and edema of eyelids, erection of body hair. Everything will happen because of this water intoxication. What happens is, excess water which is taken will lead to hemodilution. So there will be sudden drop in the sodium in the blood vessels. So that sodium hyponatremia will occur, and because of that, in unorganized tissues like erythrocytes, there will be hemolysis. So because of that, the bloody urine can be seen. Sometimes in organized cells like brain, there will be edema that will lead to nervous signs. So this is about water intoxication. This is just a differential for the bloat in case of cows. And coming to treatment, most of the time, without treating the animal, we should withhold the water for 24 hours. That will definitely animal recover. Sometimes in serious cases, whenever there is nervous signs, we should treat it. How it should be treated? It should be treated with a 5% normal, 5% saline. What we are using, the saline, sodium chloride saline is 0.9%. For these cases, we need 5% saline. This is readily available. 5% saline intravenously should be given. Some cases which can use also gives dextrose, and if there is cerebral edema, a steroid should be given. So in some cases they will be presented very late. This case was avoiding red color urine since months, but they presented very late. There was severe anemia. I told them that this animal needs blood transfusion, but the owner didn't bought his another cow for the transfusion. I scheduled it for the next day since there was unavailability of the donor. The animal died in the evening itself. That is the severity which is causing anemia. One of the condition, water intoxication, leading to severe anemia and death in cows. And prevention, how to prevent this? There should be provision of water to the cows ad libitum from the 2 weeks of age. Whenever ad libitum means whenever the animal wants to take water, it will take. Whenever we are offering ad libitum, it will not take much water. It will take whenever it needs. Whenever we are restricting, it will take bulge in a short period of duration. And salts, sodium chloride, that is normal salt, should be added every day. This will prevent this condition. Another causes of esophageal obstruction, esophagus, that leads to bloat, are esophagitis, carcinoma or granulomatous lesions of the esophagus, some poisonings with the funguses, and tetanus. These are some of the lesions. Tetanus will lead to spasm of the esophagus. Because of that, there will be bloat. Carcinomas will lead to obstruction and the gas will not escape out. That will lead to bloat. These are some other causes of the esophagus leading to bloat. Obstruction at cardia. This is one of the important thing which is causing obstruction. Whenever we get cases like bloat, we should keep that in mind that in cardia there may be some obstruction. This is intraluminal video. Here, from here we can see saliva is drooling out. This is the esophageal opening into the rumen. So esophagus opens in the rumen at the 2 o'clock position of the rumen. Just when if we are doing ruminotomy, if we insert our hand, this is the rumen. So after rumen we will get reticulum. At the junction, at the 2 o'clock position, just at around 2 to 3 centimeter back in the rumen, there will be opening. That is the esophageal opening. How to identify it during the surgery is, when we insert our hand, if we go to 2 o'clock position, we will just feel the mucous membrane feel. Like vulval lip. When we are doing pervaginal examination, if we insert our hand, we will feel soft structure. So similarly, we will get in the esophagus. So this is the esophageal opening. You can see saliva is drooling out. So in the rumen. So whenever there is obstruction to this, that will definitely lead to bloat. So one thing is obstruction of the growth, like papilloma. This is a beautiful photo which was shared by Dr. Santosh Vakchure from Maharashtra. And this is the esophageal opening where there is wart or papilloma is grown. So whenever there is papilloma at the esophageal opening in the rumen, at the cardia, that will obstruct the out passage of the gases. So that will lead to bloat. So while performing ruminotomy, we should always examine the esophageal opening for the obstruction. Whenever there is carcinomas, warts, papillomas, or any type of obstruction in the esophageal inlet will lead to bloat. This is another thing. This was shared by my beloved colleague Dr. Arvind. So this was a severe bloat case. While operating, he found papilloma at the esophageal opening. After removal of this, the animal recovered very well. This is the obstruction of the cardia. Another thing is mature amphistomes at the cardia. Mature amphistomes are not at all pathogenic in case of cattle. Only immature amphistomes are the pathogenic in the intestines, not in the rumen. But whenever the mature amphistomes are there in the rumen, whenever they are very huge in quantity, that's a normal finding whenever doing postmortems with amphistomes. But whenever these amphistomes blocks the area of cardia, that will lead to bloat. So how this type of cases will be diagnosed? This is a buffalo presented to me with severe bloat. When I visited the spot, first I inserted trocar and cannula because that was the severity. Animal was in lateral recumbency. I was not getting the time even just to diagnose it. Just I inserted trocar and cannula initially, but bloat didn't subside. So I treated it for bloat, frothy bloat, 1 day completely. On the next day, animal didn't recover. It was further complicated. So I did ruminotomy. So while performing ruminotomy, I found that this is the ruminotomy site. So I did. So these are the amphistomes. So whole area of rumen is covered by amphistomes. Even here also amphistomes are there. This is the feed material which is obstructing the view. This complete esophagus, for complete ruminal wall was covered with the amphistomes. Even it is a normal also, but whenever it obstructs at the cardia, that will lead to bloat. I suspected that in that particular case. I didn't diagnose it even by ruminotomy. I just suspected it and treated with the oxyclosanide, and the animal recovered very well. There was no other problems. This is after recovery, after 25 to 30 days. The animal recovered very well. And this is another case of bloat. It was shared by my friend, and while getting suggestion, he inserted stomach tube. This at the tip of the stomach tube, so many amphistomes were seen in that particular case. That means whenever we inserted the stomach tube, after removing it at the tip, we found huge quantity of amphistomes. So this indicates that these amphistomes blocking the area of cardia, that leading to bloat. So whenever we get a case of bloat, we can always put the stomach tube, take it out and just see the tip of the stomach tube, and accordingly we can treat it. So these mature amphistomes will lead to bloat. So how to treat this type of cases? Oxyclosanide works excellently at the dose rate of 18 mg per kg body weight. Orally at 2 doses at the interval of 48 hours will lead to success. So this is about obstruction at the cardia. So coming to ruminal causes, if time is finished, I will leave and I will continue in the tomorrow. Please interrupt me whenever time is over. Coming to ruminal causes, whenever there is ruminal atony, any condition which lead to ruminal atony will lead to bloat. So ruminal atony can be caused by anaphylaxis or hypocalcemia or anything which changing the pH like acidosis, alkalosis and ruminitis and impaction. All these things can lead to bloat. So one thing is anaphylaxis. This was a case with bloat. This was a case vaccinated with the FMD vaccine. We did in a group and we left to hospital. Immediately I got the call that there is severe bloat, cough, salivation, everything. So this is a clear this is a anaphylaxis case, and it was treated with the adrenaline. First 2 to 3 ml of adrenaline was given subcut, and after 5 minutes another 2 ml was given and animal recovered very well. So anaphylaxis will lead to ruminal atony. That will lead to bloat, and one of the serious condition we should treat with the adrenaline. So we should always keep adrenaline in your bag. That I am always following. Without adrenaline, we should not treat not even a single case. That is my sincere advice. Since I treated a case with streptopenicillin, within 10 minutes animal died. I didn't had adrenaline. If I had adrenaline, that animal would have saved. What happens is, normal anaphylactic reactions like allergic reactions, papules all over the body, eyelids swollen, vulval region swollen, these are the minor reactions. But whenever there is severe anaphylaxis, the lung edema, the fluids animal drowning in its own fluids, the whole lung will be filled with the fluids. That is the emergency condition. The only adrenaline can stop this. So always before injecting any animal, we should have adrenaline with us. That is I am practicing in everywhere I am taking adrenaline with me. So that is one thing. Coming to ruminal acidosis, how this will lead to bloat? Acidosis will lead to ruminal atony, that will lead to bloat. Whenever highly fermentable carbohydrate diet, that is the rice, paisa or ragi balls are left out, they will feed the animal with this, as we all know, and finely grind these grains. These will also lead to bloat. So sudden access to carbohydrate diet will lead to proliferation of bovis and Streptococcus bovis, that will lead to high ruminal D-lactate. So sudden fall in the pH will be there. So because of that, lactobacillus will grow, and because of that, it will draw all the fluids into the rumen. So that will lead to dehydration and ruminal atony, ruminitis. There will be severe dehydration and diarrhea. So this is the pathogenesis of the ruminal acidosis. So how that may lead to even liver abscess, infection of lung and everything. So ruminal acidosis is itself a big chapter which can be dealt for the 1 hour or 2 hour experiences can be shared. So I am just focusing on the highlights, how this will cause the bloat. So whenever there is highly fermentable carbohydrates are given, that will lead to severe bloat. In case of acidosis, main reason for death is not the bloat. In case of esophageal obstruction, the main cause of death is bloat, that is exerting the pressure on the diaphragm and death. In case of acidosis, the main cause of death is by dehydration. So always we should keep in mind that while treating the acidosis, along with correction of the acid-base imbalance, we should always treat the dehydration. So that is the thing. How to treat? That is, we can classify it as mild, moderate and severe. So mild means animal will be presented to us with the animal will be walking, and there will be mild fluid splashing in the sound in the rumen. This is one of the important thing how we can diagnose the acidosis. Keep the stethoscope on the left flank, tap it with the another hand, just listen the sounds. In case of LDA, in the last sessions of Lava TN, I clearly explained all these diagnostic procedures, diagnose about LDA, RDA, where the auscultation and percussion clearly helps. So we should keep the stethoscope on the left flank, another with hand we should tap it. So if we get clear ping sounds mean metallic sound, just ton, 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 just like this. If we get it only in the left flank, definitely it is a case of acidosis. So whenever there is acidosis, the animal will draw all the fluids in the body into the rumen. That will give the clear ping sounds, and there will be severe dehydration. So here semi-solid dung, after animal taking the highly fermentable carbohydrate sources, after 5 to 6 hours, the animal will start voiding it. Semi-solid dung will be there. So this shows that this is a mild case. This should be keep it in mind while treatment. I will come to that later. Coming to next, moderate, there will be incoordination. Animal will be wobbling gait will be there, and there will be staggering gait, that is there will be diarrhea, dull and depressed, there will be respiratory distress and complete anorexia. That indicates that the animal is standing, wobbling is there, presented to us with splashing of the abdomen. It indicates it is a moderate affection. In severe cases, the animal will be presented to us in the recumbency with the high heart rate. Though these things should be kept in mind while treating the cases. So this is a moderate case. The animal offered with the ragi balls, around 15 to 20 were given to this animal, and the animal showing wobbling gait, and the animal was too dehydrated, and auscultation and percussion showed mild ping sounds in the left flanks. We can see the dehydration, the sunken eyeballs and loss of periorbital fat, and here all the areas indicating that there is dehydration. So this is a moderate affection. So why I am stressing mild, moderate and severe is while treatment this will definitely help. This is another case of moderate case, that the same case with the dehydration. So after diagnosing this, so we treated with the soda bicarbonate solution and normal saline. So animal recovered very well. So how much to give? Always we should correct systemic acidosis and dehydration. How to calculate this? This is simple formula, and I am very much thankful to Dr. Shivaraman sir. So it was a very complicated one, he simplified it, and I am very much thankful to Dr. Rajesh of Tamil Nadu who gave hints about this, and this simplified, and very simply we can treat the acidosis perfectly. So this is how we can calculate the need of sodium bicarbonate. So one thing is, I was treating the cases of acidosis with the ampules available. Sodium bicarbonate ampules are available everywhere. 10 ml ampules are available, even 25 ml ampules are also available. Sometimes even 100 ml also available in Tamil Nadu, I feel. In Karnataka it's not available, but here I seen some 7.4 product is available. Yes sir. Yes sir. The ampules I was using, it was not of use. Why means each ml of that ampule contains about 0.9 milli equivalent of sodium bicarbonate. Why it is not useful, I will tell in the next slide. So always try to use powder form of sodium bicarbonate. How to calculate? One thing is 0.3 into base deficit into body weight. So this will give how much milli equivalent of sodium bicarbonate is needed. So 1 milli equivalent is equivalent to 75 mg of sodium bicarbonate. So 0.3 into base deficit into body weight, you take it, whatever we get, you multiply it with the 75 milligram, and that is the dose of sodium bicarbonate needed. So I will just explain in the next slide about base deficit. How to calculate this base deficit? I stressed that mild, moderate, severe. So for mild, 5 milli equivalent of this is the base deficit. For moderate, 10, and for severe, 15. You just take it blindly. This is a correct formula. 0.3 into, if it is a case of moderate acidosis, take 10 milli equivalent, that is 0.3 into 10 into body weight of the animal. That will give how many milli equivalent of sodium bicarbonate is needed. Multiply it with the 75, that will give total gram of sodium bicarbonate needed for that particular animal. So if there is any confusion, I am always free to discuss with me through WhatsApp and through phone call also. I will explain the things. So this is how, this is if an animal weighing 300 kg body weight, it is affected with severe acidosis. So severe acidosis means we are taking 15 milli equivalent as the base deficit. As I explained, 5, 10, 15. 5 for mild, 10 for moderate, 15 for severe. So 0.3 into 15 into 300, it came around 1350 milli equivalent. So I just told that 10 ml or 25 ml sodium bicarbonate ampules are not of use, since if I want to give this animal with these ampules, I need around 65 ampules for the one particular case. It is not practical. So I will go with the powder form. Here I multiplied with the 75. This is the how we can convert it into the grams. 1350 milli equivalent into 75. It came around like this. That means 101 gram. That is, we needed hardly 100 gram of sodium bicarbonate for that particular animal. So this is about correction of the acidosis. Coming to the fluid, last, dehydration. That is standard principle is 1 liter of fluid per 100 kg body weight. So one dose needed is NS, 1 liter of NS per 100 kg body weight. So this animal is weighing 300 kg. So this animal needs 3 liters of fluids, means 6 bottles of NS. So I should mix this 100 gram of sodium bicarbonate in 6 NS bottles. We can equally divide it, make a hole on the bottle, you just add it, mix it, you give IV. The animal will recover. So, sir, I am using raw also, even laboratory grade also, sir. Both will give results, sir. So this is how we can calculate. Along with this, we should always give B complex vitamins, antibiotic, antihistamines, probiotics and cut transplantations. We should always follow this. And these are some cases which are presented with acidosis and treated with the same formula. And this was a case of acidosis. First I inserted Procurant cannula and treated accordingly. Coming to ruminal alkalosis. One thing is, about alkalosis, one thing I should tell. Many veterinarians call and tells that the animal was affected with alkalosis, they treated for it. The animal was not passing the dung normally. When they checked the pH of the rumen, it was 8 or 9. So they diagnosed it as metabolic alkalosis and treated for it. The one thing what we should keep in mind is, whenever there is gut stasis for any reason, like ruminal impaction or reticular foreign bodies or omezal impaction, abomezal impaction, LDA, RDA, intestinal affections, anything, whenever there is stasis of the food, definitely the pH of the rumen will be alkaline. So the pH of the rumen, when we check it showing alkaline, that means there is no need to treat for alkalosis. We should treat the primary cause. The pure alkalosis occurs whenever the animal takes urea or high protein rich diet is given. That is the pure cases of metabolic alkalosis. So that one thing is urea. Ingestion of large quantity of urea leads to ruminal alkalosis. Most of the time prognosis is guarded. So that is the thing. How to treat the cases of urea poisoning? The signs includes twitching of the ears, facial muscles, grinding of teeth, frothy salivation, bloat, abdominal pain, frequent urination, rapid and labored breathing, and weakness, staggering, violent struggling, bellowing. The animal will die within minutes. So that is the severity of the urea poisoning. So how to treat it? Immediately after getting the information from the farmer, we should give the animal with large quantity of cold water. And another thing is 2 to 6 liters of acetic acid should be given orally. That is the vinegar available. Orally we should give about 2 to 6 liters. This will prevent the conversion of urea to ammonia. Whenever we get a phone call after 3 to 4 hours after the urea injection, these all will not work. Already there is pathogenesis happened. The surviving that animal is very difficult. Even by performing the ruminotomy also, surviving that animal will be difficult. Another thing is hypocalcemia. During hypocalcemia, there will be gut stasis. The animal will present it like this with the bloat. So we should treat accordingly. So just I am listing all the causes of bloat. So this is the one thing is hypocalcemia leading to bloat. So this was the case presented with the bloat and treated. So next thing is reticular causes. So I am just winding up my session now. For tomorrow I will cover remaining topic about the bloat and its management, and even I am covering how to perform ruminotomy also, since this is a major surgery which needs to know when we entering the reticulum, every conditions needs ruminotomy. So I am included ruminotomy procedure also in my session. Thank you all.